Hi everyone, you're welcome back to my channel. I'm Dr. Ivy, and in this channel we'll talk about health, beauty and lifestyle. And I've decided to be wearing my scrubs whenever I want to talk about health related topics, okay, to look more professional. Now today's video is about something that's affected us as ladies, or we're currently going through it, or we know somebody that's going through it. And most times we shy about it. We don't want to tell somebody that we have smelling vaginal discharge, so we tend to keep it to ourselves and battle it internally. But if you're watching this, you're in luck, because I'm going to share common causes of abnormal vaginal discharge. And if you're a man, you might want to stick around so you can share it to your female friends and relatives. For us ladies, we experience different vaginal discharge at different phases of our menstrual cycle. Okay, so now we know what is normal to us, right? In terms of color, in terms of consistency and odor. Now, when there's a variation in either of these, we know that there's a problem, right? So now let's get straight into the common causes of smelling vaginal discharge. Bacterial vaginosis is one of the commonest causes of abnormal vaginal discharge, characterized by whitish or grayish watery discharge with a typical fishy odor. Now, when you have fishy smell, typically bacterial vaginosis, is caused by an overgrowth of the bad bacteria in the vagina. Normally, the vagina has a normal flora, normal vaginal bacteria that prevents infection, help to maintain the health of the vagina. But if there is an overgrowth, if the bad bacteria grows more than the good bacteria, it causes this infection. There might be stinging or burning or itchy sensation down there. Next on the list is Trichomoniasis. It's caused by a protozoan and it's characterized by greenish, yellowish, frothy, foul-smelling vaginal discharge. There can be associated pain and general discomfort. It is a sexually transmitted infection, so you're going to treat your partner as well. Third on the list, we have yeast infection. This is characterized by a thick, whitish, cheesy-looking vaginal discharge, usually odorless or mild, odor. It smells like bread. The way bread smells like, it's not bad, but it's not the normal smell of your vaginal discharge, right? It can be associated with itchy, redness, general discomfort down there. Now, number 4 on my list, as funny as this will sound, is forgotten tampon or foreign objects. Yeah, there are some people that use tampons, they just plug it up there and they forget to take it out day 1, day 2, day 3, and it can lead to serious infection, especially one called toxic shock syndrome, that can lead to full-blown sepsis and affect all the systems of your body. Now, if you have a tampon in, please remember to remove it. You can set an alarm, change your tampon, remove your tampon, that easy. And for people that like to put foreign objects up there, please remember to remove them, okay? Thank you. Another cause of abnormal vaginal discharge has to be the gonorrhea, chlamydia. Now, these are sexually transmitted infections, and most times they have similar characteristics, such as yellowish, greenish vaginal discharge that is foul smelling, pain on urination, pain during sex, discomfort, pelvic pain, pelvic meaning your lower abdominal pain, fever. It's important to note that most times sexually transmitted infection for male and females don't have any symptoms. It's not going to present with any symptoms. You will just have the infection and it's just going to be there. That's why we encourage regular gynecological checkups, regular medical checkups to screen for these infections. Another cause of abnormal vaginal discharge would be hormonal imbalance or hormone changes. Now, this happens in cases of menstruation, pregnancy, when you're using contraceptive pills or injections. This can alter your vaginal pH and cause, a slight odor here and there. Now, if it is not normal to you, that is when you should see a doctor. poor hygiene. Many of us still don't know that you have to wipe from front to back. I'm talking about ladies now. From front to back, because there's proximity or closeness between the vagina opening and your anus. So wiping from back to front, you can transfer the bacteria from your anus to your vagina and can cause infection, bad odor. Okay, so practice good hygiene. Finally, a cause of abnormal vaginal discharge or foul-smelling discharge is malignancies. That's the cancers, especially the cervical cancer, which is seen in mostly postmenopausal women. They tend to have profuse, watery discharge, vaginal discharge that is foul smelling. You can actually smell it from a mile away. It's so terrible. That's why we encourage people to go for regular gynecological checkups and screenings. I know in this part of the world we're not really keen into that, but please, if you're saying this, get your mom or your sisters or your aunties or your friends check up. Tips for a healthy vagina. Number 1, avoid douching. The vagina is self-cleansing. God has designed it to take care of itself. You don't have to go there with feminine products, scented soaps, and trying to wash it squeaky clean. No. Okay, just use water and wash it. You're almost supposed to wash the vulva and not the vagina. The vagina is the canal, that you can put your finger in, while the vulva is the covering, where we have the lips, the outer lip and the inner lip. So you wash there with water and you're good to go. Okay, don't overwash your vagina. It's going to predispose you to infections. Number 2, wear a breathable underwear, which is cotton. Cotton leaves room for air, to go in there to keep the place dry. Because if you use other material, they're going to be humid, they're going to leave moisture there and can predispose you to infection. Okay, so wear those granny pants. Thirdly, practice safe sex. Wear the condom, protect yourself, from infection, because when you get infected, that partner is probably going to leave you. So take care of yourself and see a gynecologist regularly. I didn't put the treatment of these diseases or this condition because, as you've seen, some of them are overlapping. Some symptoms are overlapping or intertwined. So it could be this, it could be that. That's why you need a doctor to evaluate you, examine you properly and know the exact cause of the abnormal vaginal discharge, and treat accordingly. If you found this video helpful, leave a thumbs up. If you have any questions or comments, I'll be reading in the comment section. If you have any of other symptoms, there's nothing to be ashamed about. Just seek help and you'll be fine. Thank you so much for watching. Please subscribe, like, share, and I'll see you in my next video. Bye.